Learn how the keto diet can reduce PCOS symptoms, discover the best foods, get lifestyle tips and more. Have your periods always been a little weird? Does losing weight constantly feel like a never-ending battle against your own body? Is your significant other sick of all the bathroom clutter from your acne washes and products to keep your excessive hair growth on the DL? Though these strange and embarrassing occurrences may seem unrelated, if you're dealing with them and you're a female in your baby-making years, you could have PCOS. Don't be surprised if you haven't heard of it. Even though polycystic ovarian syndrome (PCOS) is the most common endocrine disorder for premenopausal chicks and usually develops when you're a teen, it's estimated that almost 70% of sufferers don't even know they have it. Since PCOS is the #1 cause of infertility in women, the diagnosis usually happens later in adulthood when you're striving to get pregnant. That means you could be dealing with the uncomfortable symptoms and dangerous health risk factors unknowingly your entire life. Here's the worst part: the medical world doesn't know the exact cause of PCOS, and no known cure exists. And it gets worse. Medications have traditionally been used to deal with the symptoms of PCOS, but they don't solve the real underlying issue of why you have PCOS in the first place. Now, don't rage against the medical community yet. Scientists are finally learning the connection between low-carb eating like the ketogenic diet and a reversal of PCOS symptoms. That's why we'll be exploring the keto-PCOS connection from the ground up today. You'll have answers to help explain topics like whether you suspect you're a PCOS sister, you've been diagnosed and have tons of questions, or you want to help a close lady struggling with it. This guide should give you everything you need to know about the keto-PCOS link. So let's start by learning what PCOS does to your body. PCOS in your body. Here's what's going on. You know how you're normally supposed to get a period every 28 days or so. This happens because one of your ovaries releases an egg to get fertilized. During this process, a sac forms around the egg as it matures on the surface of your ovary. When the egg is released, the sac detaches and goes along for the ride. You'll either have that egg fertilized by determined sperm, or you won't get pregnant, and your uterus will shed the womb it preemptively started for your future baby. You'll get your period. Or at least that's how it should work. When you have PCOS, your periods can be there 1 month and absent the next, if you even get them at all. That's because your ovaries are experiencing egg release fails. Instead of maturing and leaving the ovary nest, the unreleased egg continues to grow. Or if your egg is released during ovulation, the sac may stay behind, reseal and fill with fluid. Either way, you develop what's known as a functional cyst. Cysts are one of the classic signs you have PCOS. While a normal ovary will appear smooth on an ultrasound, an ovary affected by PCOS will have lots of small little bumps sprouted all over, which are those unreleased eggs as cysts built up over time. You can thank a hormonal imbalance of too much luteinizing hormone LH and too little follicle-stimulating hormone FSH for this. When your LH levels are high, your body starts producing too many androgens, or male hormones like testosterone. Unsurprisingly, male hormones aren't what your body needs to do girl things, so they wind up suppressing ovulation or the release of your egg instead of helping. Plus, since PCOS women have lower levels of sex hormone-binding globulin SHBG, there's even more testosterone freely floating in their blood, which makes the situation much worse. TLDR: PCOS is a hormonal disorder that messes with your ovulation and causes irregular periods. As a whole, PCOS was first formally introduced to the medical community in 1935, but the earliest published description of a woman with what we now recognize as PCOS was way back in 1721 in Italy. Yet after all this time, scientists still don't know the exact cause. The accepted theory is developing PCOS takes a combination of genetics you can't control and personal lifestyle choices which you can. Genetic factors contributing to PCOS. PCOS is common in first-degree relatives, though that doesn't mean you'll have it just because your mother or sister does. PCOS has been attributed to a wide variety of triggers, such as prenatal exposure to male hormones, excessive levels of male hormones, poor fetal growth, defects in insulin secretion. Insulin resistance is a genetic adaptation. Inflammation that causes polycystic ovaries to make excess male hormones. Genetic abnormality that develops while you're still in utero. Can't do much about that. So let's talk about what you can change. Almost 70% of women with PCOS have an increased risk of insulin resistance and glucose intolerance. This is a big deal. Insulin is a hormone that helps control the amount of sugar or glucose that's in your blood. It helps sugar get inside your cells so it can be used for energy. When you have insulin resistance, your body doesn't respond to the effects of insulin. Insulin can't get glucose into your cells, so that sugar just hangs out in your bloodstream. Now you have high blood sugar. You could develop type 2 diabetes if this becomes a regular occurrence. So when you take your genetic predisposition for insulin resistance and add higher than normal insulin levels to the equation, you may trigger PCOS. And high insulin levels don't just happen overnight. Unhealthy lifestyle choices add fuel to your PCOS fire. While being overweight may not specifically cause PCOS, 50% of women with this condition in the US are either overweight or obese. Does being overweight cause PCOS, or did PCOS cause you to become overweight? Women with PCOS are naturally more insulin resistant, and that makes losing weight and maintaining a healthy BMI the hardest struggle of your life. You may be making the situation worse by increasing your body's insulin and insulin resistance by doing things that raise your blood sugar, such as eating a high-carb or high-sugar diet, having more Netflix nights than gym days. When you don't use all the glucose in your diet, it gets stored as fat around your tummy, liver and pancreas. This fat increases insulin resistance and male hormone production, creating a never-ending cycle. Stressing out. When you're stressed and anxious, you raise your cortisol levels. This stress hormone amps up your body by releasing insulin, so your cells have enough energy glucose to run away from danger. Only most of this stress is mental, so your body never has the chance to burn all this off. Using products with hormone-disrupting chemicals such as BPA and parabens, which mimic the way hormones work in your body and confuse your body's ability to regulate your real hormones, leading to imbalances and irregularities. Ladies with PCOS who are also overweight are at an increased risk for scary health conditions including type 2 diabetes, heart disease, hypertension, or high blood pressure, obstructive sleep apnea, coronary artery disease non-alcoholic fatty liver disease NAFLD. Bleeding, or cancer of the uterine lining. Plus, if you manage to get pregnant while your PCOS symptoms are left untreated, you're at risk for premature birth or miscarriage, gestational diabetes, high blood pressure during pregnancy. That's why your gyno's first instruction is typically to lose weight if you're above a healthy BMI. Studies have shown that losing weight not only improves your good looks, it also lowers your male hormone levels and decreases your insulin resistance, two huge problems contributing to your PCOS. Losing weight may also conveniently resolve a few other symptoms you're dealing with as a result of PCOS. Let's get to those next. The signs and symptoms of PCOS. The symptoms and side effects of being cursed with PCOS range from everything from menstrual irregularities to mood issues to losing weight. Some of the most common include irregular menstrual cycles like having random periods oligomenorrhea and Mr. Absent periods amenorrhea. Infertility and trouble conceiving, because having irregular cycles makes it pretty hard to put a bun in the oven. Weight gain and trouble losing weight. See the previous section on insulin resistance. Multiple cysts on your ovaries that look like a string of pearls on an ultrasound. Not every woman with PCOS has cysts, but if you do have them, you're more likely to have PCOS. While most functional ovarian cysts shouldn't cause much pain, you may develop cysts